Hello, my name is Stephanie Rodriguez. I am doing a population level health education intervention presentation. My health education topics include nutrition, cardiovascular disease, drug abuse, mental health, and health promotion. So some background and significance include Humboldt County as a whole suffers a health disparity compared to the state of California. Also, cardiovascular disease is the leading cause of premature death and stroke in Humboldt County, then higher than the state as well. 40% of overdose deaths is unintentional injuries, are the leading cause of preventable premature death in Humboldt County. According to the CDC, depression is the most common type of mental illness nationally, affecting more than 26% of the adult population. Humboldt County's alcohol and drug use related death rates are 3 times higher than the state. Also, the Department of Health and Human Services notes that 30% of adults are obese, which may contribute to heart disease. The CDC also notes that mental health disorders may increase the chance of adopting unhealthy behaviors, making it difficult for them to make healthy lifestyle choices, therefore increasing the risk of heart disease. Also, living in a rural community may increase the chance of drug and alcohol abuse, therefore leading to poor coping and mechanisms and mental health issues. So some of the healthy people objectives of 2020 include reducing the proportion of adults who are obese and increasing the proportion of Americans who have access to food, retail outlets that sell a variety of foods and that are encouraged by the dietary guidelines for Americans. As far as drug abuse is to reduce the substance abuse to protect the health and safety and quality of life for all. Health promotion for mental health is to improve mental health through prevention and by ensuring access to appropriate quality mental health services. And as far as cardiovascular disease is to promote health and reduce chronic illnesses through the consumption of healthy, nutritious foods, achievement, and maintenance of body weights. The needs assessments include a windshield survey that was done through by me. I identified needs by visiting and investigating the environments and the behaviors in the community. Also by researching, gathering data and statistics to determine the community needs and determine educational needs as well. Also, it was by interviewing and using resources such as professional medical members in the community, such as nurses and providers, and interviewing local residents in the community. Some of the theoretical frameworks include using the precede model, which is a structured participatory model to incorporate the ideas and to help the community by providing a template for the process of conceiving, planning, implementing, and evaluating a community intervention. By incorporating an evaluation process, the intervention itself, and final outcome. These phases include investigating the environment and the behaviors within the community, researching, gathering data and statistics to determine the community needs, and determining the educational needs. In the phases of 5 to 9, we created educational materials and presented the materials to the community and then evaluated the outcomes. Some of the issues identified are the barriers, such as unwilling to learn or change the behaviors, some self-efficacy, some low health literacy, and also unable to reach those individuals in rural areas. Also, the inability to present in person due to the pandemic, unable to view presentations due to lack of internet or transportation to attend the meetings if it were to be given in person. As far as resources and services, the educational information would be provided virtually to be accessible for all, to access to mental health services and health education as well. The interventions as far as nutrition is to increase knowledge on healthy eating, encouraged by guidelines of the Dietary for Americans, to decrease the risk of obesity leading to cardiovascular disease and other chronic diseases. Also is to encourage to acknowledge the use of cardiac healthy diet. Cardiovascular disease is to promote health and reduce chronic disease through the consumption of healthy diets and achievement and maintenance of healthy body weights. This will be used by educating on health as well and the risk factors of cardiovascular disease. Drug abuse is to reduce the substance abuse to promote health and safety for all, in addition to reduce the risk of cardiovascular disease by bringing awareness of drug use and cardiovascular disease. Health promotion and mental health interventions is to improve the mental health through prevention by providing knowledge on resources and services available for quality mental health to all. In addition, is to increase knowledge on healthy coping mechanisms and promote health. The teaching techniques is to be taught in a low health literacy in a virtually appealing downloadable PDF pamphlet, and also provided an educational presentation. Provided audio and visually appealing, and also provide resources and websites easily accessible with information for participants to easily access. Some of the budget and logistics include the cost for printable education material to hand out if possible, although most would be available through PDF format. Also, the teaching presentations are on a voluntary basis by local nurses, so that won't be much of a cost. Also, possible transportation budget to the location for teachings can vary as well. So when we're talking about project evaluation and outcome measurements, I have included short-term outcomes for nutrition on cardiovascular disease. Is that by the end of the presentations, participants will be able to list 3 to 5 quality healthy foods in patients with cardiovascular disease or on healthy eating choices. Also, by the end of the presentations, participants will be able to list 3 to 5 foods to avoid in patients with cardiovascular disease. This also includes nutrition, food labeling, being able to read the nutrition labels and pick healthy foods. Also, short-term outcomes for health promotion in patients with drug and alcohol abuse is that participants will be able to list the risks and effects of using alcohol and drugs that could lead to cardiovascular disease. In addition, resources and services in the community that support health promotion. Participants will also be able to list 3 to 5 coping mechanisms that increase healthy behaviors and discuss 5 coping mechanisms to improve mental health. The long-term outcome goals for the presentation is that by the end of 2021, lower income communities will have a decrease in hospitalizations due to exacerbations in heart failure due to drug use, and participants in low-income communities will also show an increase in healthcare outcomes due to healthier nutritional choices and coping mechanisms. The results and conclusion of this presentation is that participants were educated on the importance of healthy communities. The weaknesses, though, are that sites were not available to conduct teachings and the inability to reach rural communities due to the lack of access to internet and or transportation. The future suggestions would be to follow the community in order to evaluate the long-term goals, and also continue educational classes for longer periods of time. Although the ultimate goal is that participants will make healthy changes to physical and mental well-beings. Thank you for your time. I hope this was all helpful. Bye-bye.